There we are. Setting up for your meeting. Takes a minute, so I think you should start like a couple minutes ahead to be like on time broadcasting.
I can see you're live now.
All right, we'll just put that to the side because we are live here on Arundel Patriot. We call it APAT Live when we go live. I'm Victoria Bruce, and I am the producer and the publisher of the Arundel Patriot Media Group. And this is my second time doing a one-on-one interview with a local activist about healthcare, because this is a really important issue right now. And I realized that if I could get together some of the experts and some of the activists that have been working and advocates that have been working in this space, I could help give knowledge to people about where we can go and what we can do. And that's the whole reason we started the Arundel Patriot. We got started and we went like gangbusters in 2017 after Trump was elected, because we realized that small media and local media was disappearing, and it's really important. And we are coming back strong. And it was COVID that brought us all out again, realizing that we really needed to learn how to communicate and disseminate information. So I realized that I need help. And because of that, I need some financial help. And all of my producers, myself, we're all volunteers, but we still have to have some funding to keep the lights on, and some tech people. And so we are raising money, and we are asking for patrons to the Arundel Patriot. And we have just set up a Patreon. You can join for as little as $5 a month. And we are going to bring you amazing, amazing content from some of the most interesting and enlightened and smart people, and really bring you what's happening locally in a way that you can't get anywhere else, covering local issues, but also covering national issues and anything really that affects all of us. So that being said, in order to be a patron, you can go to our Facebook page, which you're on, and if you hit shop, that shop button will take you to the Patreon page, where you can become a patron for $5, $10, or $20 a month if you're feeling generous. Or you can make a one-time donation, and you can do that by going to the arundelpatriot.org Facebook page. No, sorry, website, which is arundelpatriot.org. And all that stuff out of the way, we're going to get right into this talk tonight with my good friend Chrissy Holt. Hi, Chrissy.
Hi, Vicki.
Thank you for joining me here today from your living room to mine. And I invited Chrissy tonight because I've known Chrissy for several years, and I've been completely impressed by her never, never, never say die attitude in her quest to make sure that all Americans are covered with healthcare. And so tonight we're going to talk to her. She's going to give you, I'll let you talk about your background a little bit, about what you've got, what brought you to this place. And to, I know you're a person who has good health insurance through your employer, but you're on a mission, and tell us why that is.
Thank you, Vicki. And thanks for the invitation. I'm so excited to be here tonight to talk about all of this. So yeah, this story started 25 years ago tomorrow. My son will be 25. And he was born uninsurable with severe hemophilia A. And that moment was a pivotal, lifetime-changing moment for me to start advocating for his health care and for the hemophilia community, which then grew into, for all of us, there's so many injustices and discriminations built into the current healthcare system today that I just couldn't sit on the sidelines. And so here I am, still fighting 25 years later. Yeah.
Well, thank you for fighting for not just your son, but many people's sons, and many people who are sort of caught in that space that, millions and millions of people caught in a space where they're just not insured. And if they are insured, they're not insured enough. As a freelancer myself, I've been caught a lot of times in a place where I just skip going to the doctor. because of the deductibles. So even when we do have insurance as freelancers, we're not really covered. So I just, COVID-19 has brought to light some of the most terrifying aspects of the fact that we live in a country where not everyone can go to the doctor. Not everyone has the ability to take a day off when they're sick, and then certainly they can't go to the doctor. So I want to talk first, and I want to talk in certain different specifics, but what's happening on the federal level, and what are they recognizing that they need to do differently? Because this could easily happen again. Obviously, COVID's not going away anytime soon. What are they doing on a federal level to protect Americans now?
Well, Vicki, I would say very little. I mean, there's been so many acts already have gone through the system, and they didn't address the issues of, how do we actually cover the now 30 million people that find themselves unemployed? And, for us in the fight for Medicare for all, we're like, hey, we're gonna use this pandemic for good, right? Because we have been fighting for a long time to untie our healthcare access from our employer. And, we're the only country in the world that does that. So for families like mine, when, you're raising a child with severe hemophilia A and our bills are about $30,000 a month, right? I can't go change jobs. I can't move around. I can't aspire in a career. There's a lot of things that I couldn't do for fear of not having the health insurance that I need, right? So there's been so much suppression in our country. And let's also remind ourselves that we're the only country also that talks in terms of insurance and copays and deductibles and, all the shenanigans that the insurance industry, their whole language that they developed to deny our healthcare. Right? It's not like we pay them money and then we get to go do whatever we want to do. They created networks, they created barrier after barrier. I mean, we've lost years. I've lost years of my life fighting with an insurance company to try to get access to the healthcare that my family needs. I'm currently in a 2-year process for dyslexia training, this code, and then we change that code. Americans are sick and tired of fighting with insurance companies. Businesses are sick and tired of hiring people to administer healthcare plans and renegotiate, and that's not their core business. They just want to do business, right? So the overall Medicare for All bill, the one that, Bernie wrote the damn bill in the Senate, right? And Representatives Jayapal and Dingell have been, running in Congress. We have 120 Democratic sponsors in the House. We have the majority, but we don't have the majority leader, Steny Hoyer. We don't have him signed on to the bill. So how is it that in Maryland, we have Sarbanes, we have Raskin, we have Brown, but, we can't get everybody to sign on to that particular bill.
So can you tell us that particular bill? I mean, it's kind of astounding when I hear 120 Congress people in the House have signed on that bill. Yeah. Okay. Yep. So all we ever hear on the news is that there's no support for it and it's not going to happen. And but when I hear that, I'm like, a lot of constituents must have convinced their legislatures that this is an important thing, and yet. Silence, right? Silence in the media. It can't happen. It can never happen. Tell us a little bit about that bill and why it can happen and why you have 125 lawmakers that have signed on to that. Right. Well, so we've actually had, 4 historic hearings this year on the Medicare for All bill as well. So this is, we've had tremendous movement, and this pandemic again just highlights the need for every American to have access to the healthcare, because we're only as well in our society, right, as one of our sickest sisters or brothers. Right. And we see that now. So everybody needs access. The mechanics of the bill, I'm not a policy expert. I'm an activist, meaning I'm watching the same videos you can watch. I'm reading the same content that you can read. But my understanding of it is
there's plenty of money in the system. There's plenty of money to shift the spigot of our taxpayer dollars going to insurance companies and have that directed to our healthcare providers. So we can cut out the middleman, we can cut out the redundancy of administrative, we can cut out the lobbyists that the insurance companies and the drug companies hire to then lobby against us so they don't have to pay for our diseases, right? And we can get rid of the exorbitant executive pay, right? When you have a for-profit healthcare industry right now that is profiting off of the pandemic. I mean, United Health, which runs most of our Medicaid systems, right? So our poorest families, but yet the United Health is a for-profit organization. That executive makes hundreds of millions of dollars. That stock is just about to cross the $300 mark on Wall Street. It's just criminal that our money that we need to save the lives, over 70,000 people have died here in America. I mean, it's just horrifying to watch what's going on, and for Congress to not have act fast enough to actually get this through. So I am going to go tonight. I'm going to be asking people to do a lot of actions. I am the co-chair for the Our Revolution Anne Arundel County chapter. We're getting refreshed and revitalized here. And one of the things I'm going to do is we need everybody to call Steny Hoyer, right? In the state of Maryland, call Steny Hoyer, tell him to sign on to the Medicare for All bill. Once, he needs to hear from you. And we are in an election year, and he is primaried by Michaela Wilkes. And Michaela Wilkes is going to be hosting a town hall on May 14th. So, see Michaela 2020 and join her town hall. She supports Medicare for All. Why would we send anyone to Congress now that doesn't support Medicare for All? I mean, so there's two more bills, Vicki.
Right. So let me ask you. So I know I've also heard that there is something else that was coming through that had to deal with COBRA, which I was on COBRA once when I left a job. And if you could encapsulate, like, what's the other sort of plan that's floating around Washington right now to give healthcare?
Yeah, so finally in this, one of the last bills that is going to come through, I shouldn't say last, I don't know, but the fourth bill that's going to be coming through. And here's the thing, right? That for the other three to go through, and when we essentially should have had two separate bill processes, one for corporations and one for the people. Because when you blend the two in one bill, then people have to make those hard choices. AOC didn't sign on to these, to the COVID bills, because she knew that it was hurting the people, that the people weren't getting the money, that the corporations were benefiting. So now here we are, right? And we're trying to get two bills through. So there is the Medicare for All Crisis Act, and that's the one that we are supporting. And what it does is it helps to, again, my understanding as an activist, that it's going to help structurally change the way that Medicare actually helps to support people. Right now, there's a lot of holes in Medicare. Like our folks still have to buy from for-profit organizations, pieces to get their pharmacies, pieces to get their vision, to get other pieces. And so what this one bill does is it closes all of those gaps, and it would cover all of the COVID testing and treatments. So instead of the hospital sending the bill to the insurance company, they would just send it off to Medicare for All. So fabulous. People would be enrolled in Medicare, and they would have their bills covered, and the bill would not come home, and it would go ahead and take care of that. So I'm sure there's a lot of other details, but that's my understanding of how that particular bill will work. And it would, if you did have insurance, and it would be capped to 5% of your income. And it's a way for us to start getting the rollout process going for the Medicare and the Medicare for All crisis bill. So that's really good news, right? That means that healthcare bills are not coming home to families that are already so financially stressed. We have so much anxiety. Will we get I'm on furlough. I hope I get my job back, but who knows what's going to happen, right? So economically and from a healthcare perspective, this is historic and tragic. The other bill that is out on the floor, and there's 30 sponsors, by the way, already for the Medicare for All crisis bill.
Let me break in because we do have a question.
Okay.
And I should have said this earlier at the top of this show, but this is an interactive conversation with Chrissy tonight. She's here for all of you who are watching live to put your questions in the comments. And we do have a producer, Yasmin Jameson. Thank you for producing. And she is going through and she will text me when there's a question. So hopefully we'll have enough time to answer all of them. And the first question, Chrissy, is coming from Monica. And she's asking, how can we support that bill? I mean, it sounds like something we obviously need, the Medicare, the emergency Medicare for all.
Absolutely. So I'm so glad Monica asked that question, and thank you. So of course there's an action, and what we can do today is to call and email our representatives. So here in Anne Arundel County, we actually have 3 that represent us. So, John Sarbanes, please call him. He has not signed on to the bill yet. Let me just sidebar, the only Maryland congressman, right? Because we're represented by 10 men. The only congressman that has signed on is Representative Jamie Raskin. And if you'd like to hear what Jamie Raskin had to say about these bills, then you can go to the Our Revolution Maryland Facebook page. And there was a town hall on last Saturday, but there's a video and you can learn more about Jamie Raskin talking about these bills. But call Congressman Sarbanes, call Congressman Hoyer, call Dutch Ruppersberg, right? Those are the 3 that represent us here in Anne Arundel County. And while you're on the phone, you could just keep dialing to everybody else, but at least every day, call your congressman and send him an email.
You're forgetting Anthony Brown.
Anthony Brown, yes, please call Anthony. Yep, he's in D4.
All right, so now I'm sorry to interrupt you, but we love taking questions. So if you could go on and talk about the other plan that also is being implemented by larger organizations.
Yep. And if I may, Vicki, before I jump, the Medicare Crisis Act the bill number is 6674. So if everybody wants to make note of that, it's HR 6674. And
Yasmin, can you add these notes on that, please, so people can find them about the bill number? And also the different Congress people. I think there's also a way to search easily and find out what district you're in. A lot of people, when I lived here for probably 5 or 10 years before I knew what district I was in. So if you go to maybe Yasmin, you can find a website and post that. That would be awesome.
Maybe Art can help us too. I'm sure he's here too live. I'm sure he'll help us. So yes, we have all those phone numbers. We're happy to post them out. Our congressman would love to hear from us on a daily basis to please support HR 6674. So it was introduced on May 1st. So it's the best bill that we have right now. Representative Jayapal, she's our Shiro with Medicare for All, and we're so pleased about the work that she and her team do. Alternatively, the one that we are not supporting and that we are not okay with is one that's called the Worker Health Coverage Protection Act. And it's HR 6514. And how this works is, Vicki, when we lose our jobs, we lose our health care for the most part. And unless we're on Medicaid or Medicare, right? So when we lose that, then there could be a gap in coverage. And for somebody like us with a hemophilia, with family that has hemophilia, including myself, any gap in coverage, and that's an excuse for the healthcare company to drop you, right? Or to not actually pay these bills. So for years, I would double pay if I ever had to make a change, right? For months, just to make sure that there wasn't a minute that we didn't have coverage. But now that we don't, this bill, the Worker Healthcare Coverage Protection Act, is about covering COBRA. So it's essentially the insurance company and their lobbyists going to Congress and saying, look, give us the taxpayer dollars to cover the COBRA fees for these families. And then they will, quote, have their insurance back so that we can then use our unemployment checks to go back to paying co-pays, deductibles, work inside networks, get denied, just all the shenanigans that go on with insurance companies, right? So the fact that they know that that they're profiting off of this pandemic and going to Congress and asking for a bailout, and that right now there's 30 sponsors to that bill. So you can see these bills are neck and neck right now. And it's super important that we get people on the phones going for the Medicare for All Crisis Act to support that bill, and to also support Medicare for All. Like John Sarbanes has already signed on, Brown has already signed on, but Hoyer and of course Dutch have not signed on to Medicare for All yet. But let me just share with you what's absolutely criminal about this COBRA bill that's really upset me and upset me today. You can sort of feel my energy around it, is that there are 29 organizations that represent millions of American patients and consumers with chronic and serious illnesses. And those organizations that have signed on to the insurance bill, to the COBRA bill, include our hemophilia organization, our National Hemophilia Foundation, our Hemophilia Federation, the Arthritis Foundation, the Cancer, Leukemia, American Heart Association, American Lung, Cystic Fibrosis, Muscular Dystrophy, March of Dimes, Susan G. Komen, all of these, meaning millions. These associations signed onto the COBRA bill. It's going, yep, Congress, take our taxpayer dollars, give it to the insurance companies, and then deny our patients the care that they have been for the last decades. It's absolutely shocking and outrageous, Vicki, and it's all I can do just to, I'm so upset about it. I can't stand it.
And I can imagine, because I know you've done a lot of work for the Hemophilia Association. So why? What's the motivation for nonprofit organizations to support for giving away for-profit money rather than helping people that are actually ill from these chronic conditions?
Exactly. And knowing that, you know, every exit poll is showing that the mass Americans, the mass majority of us, 70% of us support Medicare for All, that we would all finally get access to the healthcare that we need. Over 40% of our hemophilia population has ended up on Medicaid. And let's not pretend that Medicaid is okay. Medicaid actually forces people into poverty because they have income caps. And my son and I, when we were lobbying this year in Congress, we were explaining how that works when you're over, 26, and so many of our millennials are finding themselves in this position. So the income cap on Medicaid right now is $17,000. Well, if you make, let's say on January 1st, and you make the minimum wage in the state of Maryland, which is $11 an hour, and you work 40 hours a week at $11 an hour, you have to stop working in mid-October because you will meet your income cap. Do you see what I'm saying? Like, we are forcing people to not seek their opportunity, to not seek their careers, to not, and it's not even that great coverage, right? I mean, to have your specialty, you have to travel to all these different hospitals. It's not like it's in your backyard. You don't have access to all the doctors that you want, but for some reason, right, there's this appetite for, oh, we'll just put the chronically ill on Medicaid, right? Let's just do that to them, right? And what we're watching too in this is that our Black and Brown communities are being so affected inside this pandemic. They are 6 times as likely to die than whites. It's absolutely horrifying.
It is
And
horrifying.
nobody can deny how excruciating it is. So here's the other action. So we're going to keep taking action.
I'm going to stop you because we're going to have to get some questions in because I'm getting like a long string of them. So let me go back here. We have a question coming through from Carmen, and she says, do we need to create a ballot committee to support this initiative?
So yes, I mean, I think we're always trying to recruit folks to run for office up and down the ballot that would actually support Medicare for All. And I would even lean into other progressive topics, right? Because everything is connected, to even access some of, the Medicaid opportunities or even Medicare, you need transportation. So we need good transportation. We need people to live in healthy environments inside, beautiful homes that aren't mold infected and dirt. I mean, so yes, we need candidates up and down the ballot that are going to support, if I understand Carmen's question correctly, that support, Medicare for all. And again, why would we why would we elect anybody that doesn't support Medicare for all? And so, we can press into this Biden comment, and I will say that, Bernie still gets credit. He is still on the ballot. Bernie still needs your vote here in the primary to send delegates like myself. I am a Bernie delegate. You would send me to the conference, to the convention, and we can continue to push candidates like Biden to not ignore the facts, to not ignore the financials, that we actually can and should pay and for Medicare for all, and that by not doing that, we are certainly targeting certain people like the poor, like the chronically ill. We are being discriminated against on gender and race and income and everything, and we're seeing it right now in the pandemic.
Yeah, it is shocking to see, the America the Great just completely demoralized by a virus,
Yes.
to the point where, we're sewing masks. I don't think we expected this. And we don't really feel like we have leadership in a lot of ways, especially
Right.
for the person on the ground and the small business. In fact, I'll give a plug for people like me who don't have health insurance through my employer. I've always scrambled to get it, and because I'm a small business person who's self-employed, and I know there are a lot of us. So on Monday, we're going to be talking to other small business owners. We're going to do the same format, and small business owners who are helping figure out these dynamics like healthcare and other things. But I'm going to go again and ask another question if I could, Chrissy, because I've got quite a few. Rob is asking, is the COVID-19 pandemic, is it exposing the flaw in healthcare tied to employers? And I think you talked about that a little bit, but Monica's also asking about healthcare tied to employers. She said, can you discuss the history of it and how is it systematically racist, or is it?
Well, it's definitely racist. I mean, we're seeing that just because all things aren't equal in terms of, access to the jobs that offer the benefits like insurance, right? So, is the educational system working the way that it should, right? Are all the opportunities available so that we all would have access to it? The other piece of this is that we're not all on single, we all don't have the same advantages. Some of us have different privileges because everything in our environment, the way that America was even constructed, right, is based on white supremacy. So we're not even starting from the same place to get to the same end and wealth and health and happiness and freedom for all. So everything inside this system is absolutely racist and discriminates based on, disease states. I mean, one of the actions after this call, right? I mean, let's say you have diabetes. Most of the organizations, the 29 that have signed on to COBRA, that means we have comorbidities. And when you have that inside this pandemic, again, not a doctor, so we should get Dr. Gomez on here again, right? But it makes you more vulnerable from because your body is, having trouble processing whatever it is, maybe your cancer, maybe, all these other things. So if you or your family member is a member of the American Heart Association or the American Lung Association, you need to call these associations and tell them you don't want them to sign on to that COBRA bill, that you want them to sign on to the Medicare crisis bill to relieve our families, right? Because stress also, the burden of stress makes us sicker. And it affects our immune system, and it affects everything. It affects how we interact with each other. I mean, right now, even in the quarantines, right? I mean, in the quarantine situation, domestic abuse is up, and they're actually predicting that suicides are going to go up. I mean, this is an incredibly stressful time for all of us, and it's taking a toll on everything. And one of the things that we could do to level set for everybody here in this country is just to give us Medicare for all, give us access to the healthcare and the providers that we need to heal us, physically, so we can then heal mentally and eventually spiritually. And if we ever get to the spiritual realm, right, then we would know, right, that we are sisters and brothers and we are absolutely connected, and that we do want the good for all and not what we're experiencing now with this evil.
Thanks, Chrissy. I'm going to look at questions. Another question. This is from Yasmin. What can we do at the state level and county level? So we were going to go to that next anyway, so that's good. Good segue. Let's talk about state first. We're in Maryland, although, you know, what information you're giving us is actually great for everyone who's watching. So I'm sure my mom and dad are watching out there in California. Hi, guys. That's great information. But really, I know when I met you, you had a lot of information. You actually moved to Maryland when your son was born, because Virginia, because, you know, state by state, we have this weird patchwork of crazy laws that, you know, insurance companies can get away with and say, like, you were born with a pre-existing condition. So sad. You moved to Maryland. How does Maryland rank, and what can we do better? And how can we get to a place where we don't have anyone who really can't afford to go to a doctor?
I know, it's just, again, it's so criminal. But yes, you know, our states can actually take action on this. And so for a few years, there's been a single payer bill, the Healthy Maryland Act, and I've testified for that. And it's, you know, sometimes, you know, there's a lot of different camps around this where they're like, okay, from a state perspective, you know, if all the states did it and enough states did it, we would force the feds into Medicare for all. The other argument is, well, if we have to do it from the federal level, because, for example, you know, if I live in Maryland and we have a single payer here, but I go to a hospital in Virginia, how does that work? You know, what are the mechanics if one state has a single payer and another state doesn't have a single payer? So, you know, there is an argument to be made that, you know, just a federal-wide Medicare for all program so that we can just stop all of the fighting and focusing on healthcare, and we can get on with the business of living. But every year there's been a single payer bill. There was last year. It was supported by Senator Jill Carter, who is also running for Congress, and she's over in D7. So if you're over in District 7 in the Baltimore area, please vote for Jill on the Hill, because she will give us our Medicare for all vote, which you need. And you know, but here's the real question around Maryland and the appetite there. We do have an all-payer system. I have been fighting for the mandates here in the state of Maryland for a very long time, even back in the Ehrlich years. We blocked Care First from going from a nonprofit to a for-profit, because, of course, the for-profit Blue Cross Blue Shields want to kick off all the really sick, right? All of the chronically ill, expensive people, like, you know, the hemophiliacs, and put us onto Medicaid versus, you know, keeping us on their payroll. So, you know, there's a lot to be said for trying to get it passed here. So the all-payer system helps us to control our costs. We have a monopoly in this state, you know, with Care First, with our federal employee workers and all of our state and county and city workers, everybody being on this big Blue Cross Blue Shield. So, you know, the question back to our legislators is to say, and all of the electeds really is, you know, where is our money going? You know, Delegate Henson said 30% of the Maryland state budget goes to healthcare. Well, you know, the math on that is a little shy of $15 billion in the state of Maryland goes to healthcare. Where's it going? How come everybody in the state doesn't have good access? I mean, that sounds like a lot of money. So the question we keep asking is, where's it going? Who's getting it and who's benefiting? And those are the same questions that many of us have been asking our county executive and our mayor even. So last year, we really started a good initiative, and I'm going to talk about some other actions you can take here locally. There's what's called Medicare for All resolutions, and there's about 390 of them going across America today. Cities and counties have signed on to Medicare for All resolutions. And so a group of us here, as part of our revolution, Anne Arundel County, and some Healthcare is a Human Right and Progressive Maryland, and some of us have got together, and we were meeting with our mayor, with Mayor Buckley, and he thinks it's a great idea. But the resolution has to come out of the city council, right? And our county executive Pittman thinks it's a great idea, but the resolution has to come out of the council. And what the resolution says is it states that yes, healthcare is a human right, and it encourages Congress to sign on to the Medicare for All bill. There's no funding, there's no mechanics, there's no financing, there's nothing, but it just states that all of us should have access. And by getting Hoyer, for example, to sign on, and Dutch, and getting all of our congressmen to sign on, we would actually, and we're seeing it now, get money from the feds to cover our healthcare costs. So I don't understand why cities and counties wouldn't sign on to this, because the more we can push this energy for Medicare for all, right, up from elected officials, from cities, counties, and states, telling our Congress to sign on to it, then it would release us of the burdens that we are all under, all of our budgets. So here's an example too. Our hospital laid off 1,000 workers. When Anne Arundel Medical Center laid off 1,000 workers in the middle of a pandemic, we all need to be asking, why is that even possible? When we're hearing that people can't get the treatment and they can't get the testing that they need. And that not only that, it's not equitable, right? That again, our Black and brown communities are being so disproportionately affected by this right now. So why is the hospital laying off 1,000 workers? My question goes even further. How much money has the city, the county, and the state given that hospital of our taxpayer dollars to be able to care for our people? So we should be demanding, how much money is the city of Annapolis paying for healthcare? How much is the county paying for healthcare? Why won't you sign on to these resolutions with us? And I get people looking at me like, oh, that's not my topic. I'm sorry. I'm an elected official at the city level and I don't understand healthcare. That is just not acceptable anymore. We need to be responsible stewards of all of our taxpayer dollars. And when 30% of a budget is dedicated to healthcare in the state, it is no longer acceptable for any elected official to say to me, healthcare is not my topic, or Chrissy, you talk too much about healthcare. It's like, how about you talk about healthcare? That's what I want to say.
Yeah, I mean, you're blowing me away with that 30% number, because when you say 30% is going to healthcare, do you mean it's caring for people, or 30% is going to insurance companies' pockets to make insurance companies billionaire CEOs, right? It's not healthcare. So nobody's getting cared for. Well, maybe like 10% of it, right? And then the rest of it is going into the pockets of middlemen and insurance companies and yada yada. I'm gonna go to my questions because we're getting a big long list. Monica asks, mental health will be an even greater issue due to this pandemic. Does Medicare for All include mental health coverage?
It covers everything: mental health, vision, long-term care, dental, right? Nobody covers dental, right? So much of it happens in our mouth, but not, yes. So the short answer to Monica's question is yes, including rehab. We just spent millions of dollars to open up, to have a few mental health beds here in Anne Arundel County. Before that mental health facility opened up, we had no mental health beds in Anne Arundel County. If you had a mental health crisis, you were held at our hospital in like a psychotic cell, and then you were shipped out across the state of Maryland to some facility for mental health treatment, which made it so hard for the families to visit this person. And I mean, it was just crazy. So I don't know how many beds. I think we have 10 beds now in Anne Arundel County, but to Monica's point, with all of this stress that's going on with families, I'm sure we need more than that. But yes, all of that is covered. And so much more, everything. Even negotiating drugs. Medicare for All would allow our government to finally negotiate drugs. It is crazy that we pay, I'm sure the facts are out there, but 50 or 60% higher for drugs in America than we do in the rest of the planet.
Yeah, absolutely. Yeah. I'm going to take another question. What's that? I think we're having a little technical.
I said I've even testified on that bill, the HR 3 bill in Congress about price gouging with pharmaceutical.
It's obscene. It's obscene. Annette Barber would like to ask, which candidate has the best Medicare for All plan?
Bernie Sanders, because he wrote the damn bill. So, I mean, I have my opinion and bias because, that is the best bill. It's a shame that, well, I won't get into the politics of it, but it's a shame that Liz had to really, tweak her bill and be different and not go with the bills that were already in the House and the Senate today, and then just carry on with her campaign. So, but yeah, right now, Bernie had the best bill. And still not. It's still there. It's still.
So there are two bills, right? There's a House bill and a Senate bill, Medicare for All bill in the House and the Senate. You said it's Jay Pell's bill in the House and Bernie's bill in the Senate.
Correct.
Okay. And how many Congress people have signed on to that?
There's 120 representatives that have signed on in the House. And now you're going to ask me the Senate, but I don't have the answer to that. On that.
Okay.
Oh.
So we have only one Maryland
sounds like
congressman.
So there's a little bit of a delay, but let me just go ahead and summarize. So there's a big Medicare for All bill. There's just one big Medicare for All bill. Bernie wrote that bill, and its sister bill is sitting in the House, and it's 1384, and it has 120 sponsors. And it's been around for, a long time. These are the main bills. And Hoyer has not signed on to those bills. 3 of our 7 congressmen have signed on to the Medicare for All bill. Those big bills. Sarbanes has signed on, Brown has signed on, and Raskin has signed on. That's the Medicare for All. Now, in the middle of a pandemic, we have 2 different bills. We have a Medicare for All crisis program bill, and that's 6674. The crisis bill is supporting the COVID payments so that families don't go home with a bill for COVID treatment. So that's the crisis bill. And that one has one sponsor in Maryland right now, Raskin. None of the other 9 Maryland congressmen have signed on to that bill or the COBRA bill. Remember, that was the bad insurance bill. Yeah. So right now the fight is for Medicare for All big bill and Medicare for All crisis bill. Yeah.
Oh, excellent. Thank you.
Did that help? Okay, there's a little confusion there.
Yeah, and if you could put some notes in, I know you're really good at that, into the comments as Chrissy's talking about these bills so people can remember the names and the numbers. I'm going to take another question from Vicki Gibson. She asked, will this truly be open to all people without limitation?
Yes. Yes.
Excuse me.
I love it. You guys are. So yes, absolutely, Vicki. Everybody in, nobody out. That's the essence of Medicare for All. Everybody in, nobody out, and everybody gets gets covered for the treatments that they need, and then anything outside of that would be 5% of your income, and that 5% of your income does not include unemployment. So I just want to do a shout out too for Our Revolution Maryland, because on our website are videos about what I'm talking about. There's copies of bills. There's content for you to take a look at for an education. So Our Revolution Maryland and Our Revolution Anne Arundel County Facebook pages has it on there. I'll try to get everything loaded up on my Facebook page. So the content's there. You just, as responsible voters, we need to go educate ourselves, which is one of the last things I do want to talk about, is what we can do to be a good steward.
Well, and that was another question is, from one of our viewers, how can we push Democrats to support that Medicare for All bill in Congress and the Senate in Washington?
So,
what do we say?
I think one of the questions one of the things that scares everybody is they're like, how do we pay for it? Right? Like, oh, we can't afford it. And then, you sort of shrink back from that going, oh gosh, right. How am I going to answer that? Well, we have all the answers to that. And on Our Revolution, there's a video, and it's called The Elephant in the Emergency Room. And it talks specifically about how do we afford Medicare for All. And when you do the math, and the math is all very doable, we would all save, a family like mine, I'm just going to use my us as an example, right? So we pay well over $15,000 a year, sometimes more, depending on what crisis is going on. And So the average family, they say, is about $12,000 a year in out-of-pocket costs. And that's not actually going to include our deductible, for the premiums. So the numbers start to climb, right? They start climbing into about the $27,000 range when it's all in. So when we look at the pricing of that, and you consider that the Medicare for All bill really talks about a 4% tax on your income. And I did say taxes. And the reason I am saying a tax is because that's the way the federal government collects money from people. So if my employer is not collecting my premium and sending it to the insurance company, somebody needs to collect my money. So my money then would be taxed to 4%, but I would not have my employer going after my premiums. Only a 4% tax. And that's only if I make more than $29,000. So you would take your income, subtract out $29,000 and put the 4% tax. Anyway, that number comes out to be like between $2,000 and $3,000. And there's grids that actually show you, like, if you make this much money, this is how much you would pay. So every family in America, that's in that sort of Affordable Care Act group, right, would save like over $10,000 immediately. That's how much we would save immediately. The employers would pay a payroll tax, but it would get them out of the business of administering healthcare, right, which is not their core competence, right? They would pay 10%, which would be a lot less than what they're paying now. And I think that's only if you make like $2 million in revenue, which means small businesses wouldn't even have to deal with this at all. So they would save money and they would have healthier employees and less sick days, and all of us would be happier and less stressed out. So all of that is in that video. So I think it's really on us. We have to take a personal responsibility now to educate ourselves on understanding the financing of Medicare for All and what the mechanics are. And the financing of it is we pay through taxes, and then we pay the providers through Medicare. So it's not today's Medicare program that has all the loopholes and the donut holes and all of that. All of that is expanded, closed, covered, no copays, no deductibles, no networks, no out-of-pockets. You can pick your doctors. If you waited for your doctor yesterday, you're going to wait for them tomorrow, right? So this, I don't want to stand in line stuff. It's like, come on. Right? How many people need to die in America so that you personally don't have to stand in line? And most of us have to wait 6 months for an appointment anyway. So, just debunk all of these myths. Let's agree that healthcare is a human right and everybody should have access. These are good plans. They're affordable plans. And the other piece too requires that corporations pay their fair share of taxes, which we all know that they're not, and the wealthy pay their fair share of taxes. And if everybody's paying their fair share of taxes, then it's absolutely affordable, and we don't need to be afraid of the numbers. So we should only vote for people that say Medicare for All.
Well, I kind of feel like if you talk to anyone 35 or even 40 and under, definitely 30 and under, a lot of them have that mentality, right? And that this is the number one thing that I see on Twitter. It's a non-starter if a politician is not supporting Medicare for All, because these are people that have graduated, have student debt, and are not getting the jobs. The jobs that they are getting, they're getting 1099, so they're not employees. They're getting part-time jobs with massive corporations so that the massive corporation doesn't have to give them benefits. I mean, it's just a toxic environment for our young people right now. I personally have a teenager. My teenager has to worry about her future and having insurance after 26, just like your son, who is now 25 this year.
Yeah,
26. Tomorrow he's 25. So one more year, you got to make this happen. So I see why you're in such a panic, and I would be too. I'm going to look at some questions here. Which are getting a little bit confusing.
Exactly. If I could press into that too from a corporation's perspective, because when my son and I were lobbying this year, this was his narrative, right? What am I supposed to do? Because even think about people like Amazon or Citibank, some of these big corporations, they actually quote self-insure. So they don't even go, they've already bypassed the whole insurance company thing, right? Now what they do is they cherry pick the healthy people, right? That into their organization, and then they self-insure them, which means they pay, or they have a concierge doctor program. This is sort of a new one too, where they contract specifically with certain doctors and their employees get to go there and it's all covered and that sort of thing. Well, that's all great if I don't have any pre-existing conditions. But how would I, right, with hemophilia, sit with the recruiter and be like, wow, I really like this job at Amazon, but I know you're self-insured. Will you cover my $30,000 a month in medication bills, right? How does somebody with a chronic illness test that in a job interview situation, right? That's how this just discriminates. It means that the chronically ill don't get the seat at the table, right? They don't get access to that job because they can't, quite frankly, take the chance to go work for an organization. And let's be clear, those organizations don't want sick people, right? Because you're going to take more time off of work or something. I mean, that's true discrimination right there that is built in. Plus, the self-insured employers are above the Affordable Care Act laws, right? They don't have to abide by any of that because they're, quote, self-insured. So that's where Medicare for All just falls down. Absolutely, or it takes care of everybody. And the current insurance process isn't working. And even top employers in the country aren't even buying into the insurance shenanigans anymore. So, the federal government needs to stop this. And the only politicians that sign on to this, both in the state house and federally, are the ones that are receiving campaign financing from insurance and drug companies. So let's be clear. If you are not voting with the people for Medicare for All or the Medicare for Crisis bill and voting for the people, you are voting for profits and corporations that are financing your campaigns. You are voting against the people. And that is a very, that's a bright line. That's a bright line of accountability. There's no gray area on that. The public option that some people talk about, that would actually add another program. So there's no funding for that. That would then increase our healthcare costs right through the roof. There's no money for a public program. And Maryland actually did do a public option many, many years ago. And I was part of that. And they created what they called as a high risk pool. And they put all the chronically ill together in this one pool. And of course, it completely bankrupt, right? Because these are the people that need it the most. There's not enough money to fund us. I mean, that's where lifetime caps came into. That's when, no pre-existing came into. That was all pre-Affordable Care Act. And, so the public option, we've watched that movie. It failed terribly. It didn't take care of the chronically ill, put all the sick people in one pool. And that's a super failed approach that is completely unaffordable for us to, quote, experiment with our sick people again. I mean, it's they're just, it's campaign financing,
So thank you for that, Chrissy. We're coming up on an hour. And so I want to not keep everybody here past an hour. I know I could keep you another hour, but I'm not going to tonight. We'll take a rain check. But I just kind of want our viewers and people that are watching this to kind of, I guess we need to have like the deeper conversation of like, why in the world, why in this entire big, beautiful planet of it, living in a country that is, one of the richest and most successful economies, why are we so broken in our healthcare? And why do we feel and why are we told that we don't deserve better? And I think it's going to be a change of mindset. And I see young people that they're not protected by those insurance companies anymore, or the jobs that have them. And I feel like, there are people like Steny Hoyer that have been 150 years in Congress now that are not going to change. But the time is marching on, and I hope that we march past people that are not doing what's in the best interest of us and are doing what's in the best interest of the insurance companies. That's my editorializing. On that note, I want to thank you for being here tonight. And I want to give you a last word, but I also want to plug the Arundel Patriot because this is incredibly important information. I'm sitting here at my kitchen table because I really, really believe that knowledge is power. And if we don't, I mean, Chrissy's done the work. And so in an hour, you just learned so much that it took her years and years to know. And she's on top of it. I plan on having many more advocates, experts, activists on this program and other programs. And we're starting up big with the Arundel Patriot. If you would like to be on the ground floor of our mission, you can become a patron by going to our buy button on the Facebook page. I think it says shop. I just set it up today. And for $5 a month, you can really help make this a big thing for all of us, because we all need the knowledge. And there's something I remember from biology class called commensalism, and it's a form of two organisms helping each other symbiotically. You know, like the little birdie that eats the dust out of the elephant's ears. We all have to be symbiotic to each other in a way that's positive. Symbiosis can be where right now parasitism, where government or where insurance companies are like parasites on our tax dollars, or we can do things that support each other. So let's have these kind of great relationships and talks and teach each other, and let's all grow together. So thank you for that, Chrissy. And I'm going to give you your last word to wrap up for Medicare for all and ensuring that all of us are not insured, but that we all have health care.
That's exactly right. So thank you so much, Vicki, for having me tonight. I'm definitely going to hop off and give you a donation. So I love the Arundel Patriot. I'm a huge fan of all of the work that you and your team do. It's so fabulous because we need to be able to have a place to share this information with each other so that we know what is the action, what do I need to do? And hopefully tonight you have learned a lot of things that you can do. You know, call your associations if you're part of Arthritis Foundation and tell them not to vote for COBRA. Call your congressman, tell them to vote for Medicare for All and Medicare for All crisis. You know, call your county council member and say, sign on to the Medicare for All resolution, or at least listen about it. Healthcare is a local topic. So there's so many different ways to plug in. Join us at Our Revolution, Anne Arundel County. We are, building momentum. We've got lots of members. We're organized, and when we organized, we will win. And so I certainly appreciate you having me on tonight, and I'd be happy to come back anytime to keep talking about Medicare for All. Thanks, Vicki.
Thanks, Chrissy. Thanks, everybody, for watching.
Bye,
Again,
everybody.
Go to the shop button, and I'll have Yasmin add a link to the Patreon account here. And you can also go to our website if you'd like to make a one-time donation. It's arundelpatriot.org. And we need writers, we need producers, and we need a huge bunch of people because we're going to have this great symbiotic relationship, and we're going to teach each other. So thanks. Good night, everybody.
Good night. Bye.